Knock, knock. I'm Mariah Cavage. I'm your nurse today, and we are going to be doing sterile dressing. My patient, I would close the door, and I would make sure there's privacy. My patient is Yankee Candle 3189. That's the tar. The physician's order is Yankee Candle 3189. No known allergies, no known allergies, no allergies to tape or latex. And we're going to be doing sterile dressing daily, sodium chloride to clean the wound, sterile dressing daily, sodium chloride to clean the wound. Okay, I'm going to set this down, wash my hands, and then I'm going to ask my patient, what is your name? And they'll tell me their name, and then I'm going to also check their wristband, which is Yankee Candle 3189. No known allergies, no allergies to tape or latex. I'm going to set this down, and I'm going to get my patient's wound uncovered, and I'm going to get my bag positioned. Okay. I would also give them pain medication before we start taking off the wounds to prevent any pain or to help with pain. I'm going to put my gloves on. I'm going to take off the dressing. The first one, I'm going to check the coca, which is color, odor, consistency, and amount, and then I'm going to put it in there. But when I take these off, I'm going to make sure the patient doesn't see them. I'm going to check the color, the odor, the amount, and the consistency. The color, the odor, the amount, and the consistency. I would examine the wound and make sure the size of it. I would check the size of it and if it has any extra drainage. I would also, before I start this, I would check the drain or the tube to make sure it's in the right position. Okay, and then I'm going to take my gloves off. And I'm going to position my stuff. And I'm going to use that. And then I'm going to have this back. I'm going to open my bowl first. And I'm going to just drop that in the trash. I'm going to check my sodium chloride with my tar, so that the dose, the amount that I need, the route topical, the time right now, the reason to clean the wound, the individual Yankee Candle, the medication is sodium chloride 0.9%, and the expiration day is 2/21. So with this, I'm going to hold the label in my palm, and I'm going to lip the solution in the trash. And then I'm going to pour 4 to 6 inches above the bowl the amount that I need. And then I'm going to recap the solution. And I'm going to put it here. And then I would also make sure I check the bottle for or change the bottle depending on the agency. And now I'm going to start opening my stuff. I'm going to start with this. Make sure I do not cross-contaminate. Okay. Now I'm going to sanitize my hands. And after I would take off the wound stuff, I'd make sure I sanitize my hands. I'm going to put the gloves on. I'm going to sanitize my hands one more time. Make sure I grab the lips of these. And I would start with my non-dominant hand. And I would only touch the inside of the glove, would not touch the outside. Then I'm going to Now that my gloves are on, I'm going to keep my hands above my waist. I'm going to put the 3 pads into the water, or the solution. Okay. Now I'm going to drain these and separate them. Now what I'm going to do is I'm going to check the sutures to see if they're like up or not, and if like they look sore, I'm going to dab it. But I'm going to start from the top to the bottom and the center first, throw it away. Then I'm going to do the furthest side, throw it away. The side closest to me, throw it away. And then I'm going to grab 3 to dry. I'm going to dry the center from top to bottom, throw it away. The outer, top to bottom, throw it away. Inner, top to bottom, throw it away. And now I'm going to place 2 on here. And I'm going to grab this. Place it on here. And now I can take off my gloves before putting the tape on. But when it is inappropriate to take off the gloves, I'm going to grab my tape. Okay. Now I'm going to cover up the patient, make sure they're comfortable, give them their call light, document my 7th right, and wash my hands.